Okay, so we're going to talk about concussions, myths and truths, and how this affects students. So, the chapter that we read, it talks about concussions related to sport injuries. Now, these are sports that adolescents are playing, that our students are playing, that kids are playing. And we're going to go into busting the myths of concussions, all the things that aren't true about concussions, as well as exposing the truths of concussions. And how we're going to do this is we're going to go into how this impacts students' behavior. So, what a student with a concussion behaves like? We're going to go into how this directly affects the student's brain. So, what's happening scientifically when a concussion occurs. And then we're going to talk about what parents and specifically teachers can do to not prevent concussions because sadly it's been proven that if a child is playing sports, no helmet, and there's no true way to prevent a concussion. But what we can do to understand concussions more, to explain the significance of them to our students or our children, and also how we can recognize the symptoms for a deeper rooted head injury that might occur from a concussion. Okay, now let's get started. Okay, so I'm going to bust some of the myths about concussions. So, one of the first myths is that concussions affect everyone the same way. Now, that simply isn't true. So, concussions can vary depending on the speed of the impact that occurred. It can depend on the age of the person it occurred to. It can even depend on the gender. And we'll go more into that later in the presentation. But some people even have a genetic predisposition to concussions. Crazy, I know. So, it's been proven that concussions don't affect everyone the same way. Now, secondly, they're a problem not just in contact sports. So, some people think that, oh, if you don't play sports, then you'll never get a concussion. But concussions can occur from car accidents, falls, and even just roughhousing within, your family. If your brother's getting on your nerves and you're just roughhousing a little too much. So it's not just related to sports, although playing sports does increase your likelihood to a concussion immensely. Okay, and also the last myth is that every time you have a concussion, you black out. Now, this isn't true either because concussions can happen without blacking out.
So, how does a concussion impact the student's behavior? In this, that determines how they react to things. So, they begin vomiting, they can't think clearly, they can't concentrate, they can't focus. They suffer from blackouts where they don't remember anything or they don't know where they are. They suffer from mood swings. They can be fine 1 minute and then the next they can be angry or sad. They suffer from symptoms of depression. They suffer from insomnia where they can't sleep. So, this can affect them in their studies where they're not sleeping, so they're not able to concentrate in school because they're tired. They suffer from a ringing in their ears, and they also complain of being sensitive to light, which can affect them because the classroom can have harsh lighting. And in a classroom discussion, if a student has ringing in their ears, they're not going to be able to focus or concentrate on what the other students are discussing.
Okay, I'm just going to go through this list pretty quickly. So, we've gone through some of the effects on behavior, just generally, and now we're going to talk about learning behavior. So, these are some of the signs that we can detect in our students, or you as parents can notice that's going on in the child's schoolwork. So, they can't complete simple assignments. So, that means that any little task is difficult for them. They can't focus during class. They have low scores on attention tests, so their attention span is really low. They're moody and agitated when it comes to completing assignments. So they're in a bad mood or they don't want to do it for no apparent reason. Short term memory is affected. So they have problems remembering something you might have just told them, or they seem very absent minded. Light in their classroom may bother the eyes. So people who have experienced concussions, they have a higher tendency to have a lot of migraines. So, any type of light or brightness can trigger those migraines. They have anxiety about grades because all of these things are going on in their mind and they're just anxious about not performing. So, then they get paranoid. They get paranoid about this anxiety, paranoid about the headaches they're going to have, which in turn makes them have even more headaches.
So, how do concussions affect the actual part of the brain inside the brain? Or a person suffers from a concussion, the protective fluid around their brain is not thick enough to protect itself against the sharp blow to the head, whether that be helmet to helmet, hitting your head on a wall, hitting your head on something other than any of those other things. It can be a multitude of occurrences. The brain ends up, after the blow, the brain gets jostled against the skull and damages the brain's neurons, where these neurons cannot send signals to the rest of the brain. So the damage becomes cellular and it interrupts the normal functioning. This also causes calcium and potassium to flow into the brain, which causes the destruction of brain cells and decreases energy from the restriction on glucose. So, in this, the brain cannot break down the glucose because of the overflow of calcium and potassium, and thus it affects the function of memory because this means that the production of the glutamate receptor in the brain, which is necessary for memory, is not, that production is being decreased, and so the person loses part of their memory. Their brain cannot function correctly. From the cognitive damage to the brain, it also suffers neurological damage. So it can develop epilepsy, like in the example of Holly. The student or a person can develop a neurocognitive stall where their brain doesn't process the information as quickly as it should. And it can also cause chronic traumatic encephalopathy, which is an example of Nathan Stiles from 2008. He was a high school football player. It was his senior year, and he suffered multiple concussions. And instead of listening to the doctors and sitting out a few games, he was allowed to play in a game in which he got hit, and afterwards he collapsed on the sideline and he began suffering from seizures. Um, Even though he was rushed to the hospital and airlifted and they attempted to do surgery, there was too much bleeding on his brain and he later died. So once he died, the autopsy showed that due to the trauma in his brain, He had a brain that was filled with a certain type of protein that allows for the fibers inside of his brain to twist and choke the brain cells, which is what happens in Alzheimer's patients. So, this is actually a really serious occurrence, and using Nathan as an example can help bring awareness to teachers that we need to be able to acknowledge the students that are at risk, even though concussions can happen to anyone. Mainly the students who play sports are the ones who are at risk, especially the contact sports like football and soccer, as the examples earlier. But in this, we need to be aware of what can happen because this can directly affect the learning and the comprehension that we're trying to teach the students. So there are different effects on adults versus adolescents when dealing with concussions. An adolescent requires a lot more recovery time than an adult because adolescents' brains are still developing. So whenever there's trauma to it, it directly affects their brain and the function. However, adults already have a developed brain and they recover a lot quicker than adolescents. So for adults, it's 3 to 4 days. And adolescents, it says the younger the child, the more time needed. So if it's a older teenager, then maybe it could be 1 to 2 weeks. If it's a younger teenager, it could be 2 to 4 weeks. And any younger than that can be a lot longer for the adolescent to recover from the trauma. But the most important fact about this is that in adolescence, because their brains are less resilient, their working memory, which is where most of their attention and their focus needs to be during a lesson, is affected because it's not able to process information and hold it there and transfer that working memory to long term memory. So, whatever the lesson may be, they're going to struggle a lot more with it, and processing it is going to take a lot more time. So it's important that teachers understand that this directly affects the instruction in the classroom.
What can teachers do to assist students who have concussions? So, we've talked about ways that you can recognize the symptoms of a concussion or the symptoms of a deeper brain injury. And we've talked about how that can affect their learning behavior. But now we're going to talk about exactly what teachers can do to help recognize when a concussion has occurred. In previous slides, we talked about the different learning behavioral changes that adolescents could go through if they have suffered from a concussion. So, remember earlier in the presentation, we talked about how that could be mood swings during the about class schoolwork, or they might be anxious about tests where they weren't before. They might have a shorter attention span during class time or getting schoolwork done outside of the classroom. All of those are behavioral changes that we as teachers should be aware of, especially in our student athletes. Also, because we are now aware of all of this information, because after this presentation we now know what happens in the brain when a concussion occurs, all the symptoms, all the effects, we're the people who should be letting the coaches know, or even staff members of these sports teams. So, the people who are involved in the athletic departments, the parents, the teachers, the coaches, all of them should have access to this information. They should all be totally aware of the effects and the symptoms of concussions and what needs to be done and the warning signs that a concussion has occurred. So, if the student has had a concussion, we need to keep in contact with parents about what we can do to help them with their schoolwork, what we can do to help them get the work done, what we can do to help them recover. We also need to understand and assist the students within the classroom. So, if they have suffered from a concussion and they do have a shorter attention span, we need to be able to give them the materials that they need or give them the more time that they might need to be able to fully recover from that concussion. Also, we need to notify parents if we notice any of these behavioral issues or any of these symptoms start appearing. We need to notify them immediately. We need to talk to the coaches. We need to just be super involved and aware, and especially our students athletes when it comes to these different behavioral changes.